Thanks. I'm gonna make sure we're okay, good. All right, thanks for joining us today, ladies and gentlemen. The Auditor of State's Office is releasing a report relating to nursing home regulations in the state of Iowa and the poor performance by the state in overseeing nursing homes. Obviously, so many of us have heard about terrible outcomes for our nursing home residents, for Iowa's most elderly and vulnerable residents, people dying in nursing homes, people laying in beds without any care, all kinds of fines being levied and being suspended. We're here today to take a look at our staffing levels. As it turns out, Iowa is actually 46th in the country for licensed nursing staff per resident, 46th. We have the 17th highest turnover rate in the country for our nursing home staff. 11 out of 20 nurses typically who worked at a certified nursing facility in the previous year are actually no longer even employed at that facility because turnover for these positions is so high. We have calculated that the state of Iowa conducts inspections on average every 17.1 months. That is 4 months more than the average for the federal mandate requiring inspection every 12.9 months. In addition to that, CMS instructs states to inspect individual nursing homes on average every 16 months. In fact, 85.4% of Iowa's 403 certified nursing homes didn't meet that expectation on at least one out of their last 3 inspections. To prepare this report, the auditor's office used publicly available information from the Centers for Medicare and Medicaid Services, and we calculated the duration between completed standard inspections across all certified nursing homes to determine the frequency. We also took into account the national pause on inspections at nursing homes during the COVID-19 pandemic. So we're making sure that we are accounting for this fairly. This is just an issue that has been the subject of lots of questions, been the subject of lots of coverage, and we thought that this information would be hopefully useful to policymakers as they decide whether or not they want to do something about the crisis in Iowa's nursing homes. I'll take any questions.
I'll understand Aaron Murphy from the Gazette. Are you aware of any action? And I've reached out to the federal agency, but are you aware of any action taken by CMS regarding this? Has there been any expression of concern from the federal level?
I don't know of any action beyond what I've seen in the newspapers. Certainly, they may be looking at this as well. We're not sure, but we oftentimes in our reports issue information that is then useful on the federal side, and the feds often issue information that's useful on our side as well. So it's all part of a little bit of oversight here, us looking at the job that the Iowa state regulators are doing with inspection of nursing homes. Anybody else got
Hi.
anything?
Hi, sorry. This is Michaela with the Des Moines Register. Are you able to speak at all about what might be driving this particular issue or sort of these delays in inspections for these nursing homes?
Sure. I think a piece of this absolutely is the fact that Iowa has a workforce crisis and that we've seen the legislature putting a lot of effort and the governor putting in a lot of effort into other things like culture wars, as opposed to bringing more people into the state of Iowa to actually do the work that Iowans need to have done. In addition to that, a lot of this work is very poorly paid. Folks are doing really what you could say is the Lord's work, right? They are dressing people, they are helping people bathe, but oftentimes because of low reimbursement rates, they could actually make just as much flipping burgers at McDonald's.
Any more questions?
I'll just follow up. This is Aaron Murphy again. I'll follow up to that. Is there any way you're able to discern from your work on this report, Rob? The legislature considered legislation that would add some funding and to have more inspectors. And that didn't pass, but is it something as simple as that, as just having more people to go out and do these inspections? Or I don't know if that's something you got into in your report.
That would absolutely make a difference, but notice that it didn't pass, right? Why, if we are way below the average for nursing home inspections, why would we not? Let me start this one over again, Aaron. If we're way below the average for nursing home inspections, why would we not fund additional inspections? The entire purpose of the inspection is to make people understand that someone may be coming to take a look. That helps them do a better job of taking care of our elderly and vulnerable residents. It seems to me like that should be a priority.
This is Roger from WHO. Is there anything other than, I mean, everything just comes down to money? Are there any other policy ideas that maybe, I don't know if there's anything else you can suggest, or is it just purely a matter of money?
I don't think that anything is purely a matter of money, but getting into the policy particulars of it is much more the legislature's job than ours. Ours is to look at compliance, whether or not we're following rules, whether or not our nursing home inspections are up to snuff, and to talk about money. That's our wheelhouse. Certainly, there's other things that could be done, but I think with the state of nursing homes in Iowa, the answer is clearly to do something. All right. Thanks, everybody.
Thank you all.